All right, today we're talking about something pretty amazing. A single pill that has this absolutely gigantic impact on global health. It's called albendazole, and you can think of it as a microscopic takedown artist for worms. Now, this is not just some other pill you might pick up at the pharmacy. We're talking about one of the most effective weapons in the entire arsenal of global health. It is quietly, and I mean quietly, changing the lives of millions of people all over the world. And that just brings up this huge question, right? It almost sounds like science fiction. How in the world does one simple little pill actually find and defeat a parasitic worm that's living inside a person's body? Well, that is exactly what we are going to break down. So let's set the stage for this microscopic showdown. You've got the pill, albendazole, in one corner, and in the other corner you have the parasite. So first off, what exactly is albendazole? The technical term is a broad-spectrum anthelmintic agent. I know, it's a mouthful, but really, that's just a fancy way of saying it's a super powerful deworming medicine that's designed to fight a whole bunch of different parasitic worms. It's not a specialist, it's more of a generalist that can take out all kinds of invaders. And to really get a sense of how important this is, it's on the World Health Organization's list of essential medicines. Now, this list is a huge deal. It's basically the best of the best, the safest and most effective medicines that any health system needs to function. Making this list means a drug is considered absolutely critical for public health.
Okay, so to really understand the weapon, we first have to understand the enemy, right? Let's talk about these invisible invaders that albendazole is built to fight.
And we're talking about a huge range of targets here. Albendazole is an incredibly versatile fighter. I mean, it takes on the common intestinal worms you might have heard of, like roundworm and pinworm, but it also goes after much more dangerous enemies, like hookworm, which can cause serious anemia, and even the larval cysts of tapeworms that can literally embed themselves in your body's tissues. Okay, now for the really cool part. This is the heart of it all. How does this pill actually win the fight? Well, the strategy is nothing short of cellular sabotage. It's this brilliant and super precise four-step takedown. First up is infiltration. The drug gets absorbed by the worm way more easily than by our own human cells. Then, step 2, binding. Once it's inside, it latches onto a vital protein called beta-tubulin. Just think of this as the microscopic building block for the worm's internal skeleton. Step 3 is inhibition. By binding to those blocks, it stops the worm from building anything. And that leads right to step 4, total shutdown. And this really shows the genius of its two-pronged attack. Albendazole dismantles the worm's internal skeleton, and at the same time, it cuts off its power supply by stopping it from absorbing glucose. It's kind of like a saboteur sneaking into a factory, cutting the main power lines and taking out the support beams all at once. The parasite is paralyzed, it starves, and eventually it's just flushed out of the body. So we know how it works, but where does it do its work? Well, its real-world applications are incredibly diverse. We're talking about treating infections from the gut all the way up to the brain, and pretty much everywhere in between. You can really break it down into two main categories of infections. First, you've got your intestinal infections. This is where the adult worms are just hanging out in your gut. But then you have the much more serious tissue infections. This is where the larval stages or cysts have actually migrated out of the gut and invaded organs like your liver, your lungs, or even your brain. And this just shows the incredible range of this drug. Yeah, it treats common things like roundworm and pinworm, but it's also the frontline treatment for some truly terrifying conditions, like neurocysticercosis, that's a tapeworm infection in the brain, and hydatid disease, which causes these large cysts to grow in your major organs. And let's just pause on that brain infection for a second. As our source material points out, treating neurocystic sarcosis is one of the single most critical uses for albendazole. This is a condition that can cause seizures, severe neurological damage. It's incredibly dangerous. And for that, this drug is often a life-saving intervention. All right, so we've covered the what, the why, and the how. Let's switch gears and get a little practical for a minute. Let's look at the user's guide for this powerful medication. Now, if there's one thing you take away about actually using this pill, please let it be this. It sounds so simple, but it is absolutely crucial. Take with a fatty meal to maximize absorption, and there is a very specific reason for this. So why the fatty meal? What's the deal? Well, on its own, albendazole is actually pretty poorly absorbed by our bodies. But get this, taking it with some fat increases the drug's absorption by up to 5 times. That one simple action gives it a massive boost in effectiveness. Now, of course, like any powerful medicine, you gotta talk about potential side effects. The more common ones are kind of what you might expect, headache, maybe some stomach pain, but it's really important to know about the serious but rare side effects, things like bone marrow suppression. This is exactly why medical supervision is absolutely key, especially if you're on it for a long time.
And now for the big one. This is the most critical warning, and it is totally non-negotiable. Do not take albendazole if you are pregnant. Simple as that. The drug has been shown to cause birth defects in animal studies, so it is strictly forbidden during pregnancy.
And there are just a couple other key precautions to keep in mind. It should be used with caution in people who have liver disease, and for those long treatment courses, like for a brain infection, doctors absolutely must monitor things like blood counts and liver function to catch any potential problems early on. So when you put all of this together, from the cellular sabotage to the real-world uses, you come right back to where we started. Albendazole is, without a shadow of a doubt, an essential medicine. It really is a cornerstone in the global fight against what are called neglected tropical diseases. Its ability to treat both those common gutworms and these life-threatening tissue infections, it gives it this profound, lasting impact on global health. It prevents disability and saves countless lives every single day. And that kind of leaves us with a final thought, doesn't it? Albendazole is just one incredible example on a pretty long list. It really makes you wonder, how many other essential medicines just like this one are out there, quietly and effectively saving millions of lives every single day, far away from any headlines?